I think one of the questions that I wanted to talk about today is the challenge of what really constitutes a person dying from coronavirus, COVID-19. I would like to say, as a preface to that there isn't any pressure on me as a certifier or colleagues that I talk to at least, that there's a desire to over-report how many people have died to make the crisis look worse, or to under-report it to mitigate whatever agenda that might favor. I think I've heard people talk about these, but I have to say my experience, especially locally, is that those are outliers. That's not really a reality that I think has any basis in truth. We're not hiding deaths, we're not over-reporting deaths. The Centers for Disease Control and the National Centers for Health Statistics gave guidance what constitutes a coronavirus death. We follow those. They were pushed out to all healthcare practitioners in the county and in the state of Ohio. They are good, reasonable, and fair, and they're a good way to track the extent of the epidemic on mortality. So why is there ambiguity? A couple of reasons. There's people who die very obviously from coronavirus. It's a respiratory infection, and if someone has pneumonia and they're COVID-19 positive, well, that's a very obvious death related to coronavirus. Many of the people who have passed away have underlying illnesses. So if someone had COPD, for example, they already have a compromised respiratory function, and many people will die from COPD, but the coronavirus certainly is not a help in any of those situations. These are associated deaths. What becomes less clear, though, is not everyone who tests positive for coronavirus dies from coronavirus. So our testing, as I'm sure you've heard, as I've heard, has been a repeated stumbling block in a lot of ways to get an understanding of the extent of the disease. But it would be foolish, I think we would all agree, if somebody died in a car accident who had tested positive for COVID-19, and we would say that's a COVID-19 death. That's a car accident death. It's not a COVID-19 death at all. And we're not hiding the prevalence of the disease by saying, yes, they had COVID-19, but this wasn't a COVID death. I can't stress that enough because it concerns me, and I would say, there are issues about COVID that are probably going to take months, if not years, to fully answer. And some of those are just going to have to wait for. I would say, though, that with the executive and with the members of the Board of Health, that we're going to strive to answer as much as we can, as fast as we can. But I think that one of the great mistakes that happens, and we've seen it already in this pandemic, is misinformation is worse than no information. I want to give you honest, accurate information. Everybody in the county does. And I think that it would be fair to say some questions I can answer now, some questions are going to take longer to sort out. But as we do know, I want to give you the best information for the public so that we're not overreacting and not underreacting. It's a serious disease. Thousands of people in our country have died of COVID-19. I don't think that's an overestimate, and I don't think that's anything that we can treat lightly. But I also don't want to think that we have to go into an extreme response necessarily that isn't justified by science either. I thank you for the time. I thank you for the opportunity to talk to you this morning, and I'll hand it back to Terry. Thank you.